My name is Amir Kazory. I am an associate professor of nephrology in the Division of Nephrology at the University of Florida. I just presented in the International Academy of Cardiology in Vancouver, in Canada. The title of my talk was The Emerging Role of BUN, blood urea nitrogen, in the complex interactions of heart and the kidney in the setting of acute heart failure. I basically started with some physiologic considerations, going through the mechanisms by which the kidneys increase urea transport when a patient has neurohormonal activity which is exaggerated. Then I went through some clinical trials to show that these physiologic considerations have been shown in human beings, and that it has been shown that increased levels of BUN are associated with worse outcomes in patients with heart failure, both in the setting of acute heart failure as well as stable heart failure patients. After that, I reminded the audience of 3 new trials that looked at the BUN to creatinine ratio as a marker of prognosis. And they all showed in the setting of acute heart failure or stable chronic heart failure that patients who have BUN to creatinine ratio that is increased compared to the general population or compared to a different cohort of patients with heart failure, they are at increased risk of mortality and worse outcomes. So I think we need further information on this specific topic, but until now, we should realize that BUN is more than a simple marker of renal function, similar to serum creatinine. I think that BUN is an encompassing factor that also includes renal function, but is a marker of neurohormonal activity. In other words, more than being a marker of renal function, it is a marker of renal response to a systemic problem, which is neurohormonal activation in the setting of heart failure. I think future research will tell us if using this marker as well as other markers that we know, such as those for markers of congestion, for example, if we put all of these together, we can have a better idea of how the patient's prognosis would be at the time of his admission.